Hello my geniuses, welcome to another anatomy lecture series. Today is a great science tutor LAWRENZO, and we'll be talking about the wrist joint today. So last one we talked about the elbow joint, and we have talked about the shoulder joint. So we're talking about the wrist joint, the same way, the same outline, the same everything. So you watch that one before you come here. So we are trying to do the joints of the upper limb. So we have talked about them. So all I want you to do is to look at the pictures and you follow it up 100%. It's very important. It's very important for you to know. It's very good for you to know. So because with the anatomy you could easily treat, and you use it for your MBBS examination, your USLME exam, your OC exams, and other external exams you want to use it for. So if you are just new to my channel, make sure to subscribe and turn on your post notification button so that anytime I drop any video you'll be sure to be notified. If you want me to make a video for you, just drop it down in the comment section. I promise I'll make that video solely for you. So let us jump right into the video. So with the same outline, we'll be talking about the wrist joint. So when you see the wrist joint, we're talking about the articulation between the radius, and we're talking about the articulation within the carpal bones. So this between the radius bone and the carpal bone, we have what we call the radiocarpal joint. Another name for the radiocarpal joint is the wrist joint. So first of all, let us introduce it. Let us introduce what it is. So the wrist joint is a joint between the distal end of the radius. Again, the wrist joint is a joint between the distal end of the radius and the proximal carpal bones. The proximal carpal bones. So you see now in the carpal bone we have 8 carpal bones. We have 8 carpal bones. She looks too pretty, try to catch her. She looks too pretty, try to catch her. So in the she looks too pretty, the proximal one is she looks too pretty, which is scaphoid, lunate, triquetrum, and the pisiform. Scaphoid, lunate, triquetrum, and the pisiform. I get him now. So in this articulation, the pisiform do not take part in the articulation. Yeah, it is only the radius and the first 3 bone, which is the scaphoid, lunate, and triquetrum. So the pisiform do not take part in this articulation because it's a primary sesamoid bone. I get him now. Increase the leverage of the flexor carpi ulnaris. Again, it increases the leverage of the flexor carpi ulnaris, so it doesn't follow in the articulating process. You get it now. So since you have understood the between the distal end of the radius bone and the proximal and the proximal carpal bone, which is she looks too without pretty pisiform is not there. So since you have understood that is how it is, 8 carpal bones, she looks too pretty, scaphoid, lunate, triquetrum, pisiform. Try to catch her, trapezium, trapezoid, capitate, and hamate. Go and watch my video on the carpal bone. It's just short, so watch it and come back here. It's very easy for you to know. So the ulnar do not also take part in this articulation. It is just radiocarpal bone forming. It's just radiocarpal joint forming the wrist joint. The ulnar do not take part, and the pisiform do not take part in this fellowship. So it's very important for you to know too. So what type of the joint it is, don't forget. So I've introduced it between the distal end of the radius and the proximal carpal bone to form a radiocarpal joint, or we call it the wrist joint. So hope you are enjoying it. Hope it's sweet for you. So the next one is the type. So what is the type of the joint? What type of joint it is? It can be the ellipsoid type of the synovial joint. Don't forget, ellipsoid type of the synovial joint, or it can be the synovial joint of an ellipsoid variety. A synovial joint of an ellipsoid variety. So very easy. That's what the joint is about. You get it now. So the same thing I talked about the others. After my introduction, I said the type. In the last video when I talked about the elbow, I said it's a hinge type of a synovial joint or a synovial joint of a hinge variety. Why this one, the wrist joint, is a synovial joint of an ellipsoid variety, or an ellipsoid joint of a synovial joint, or ellipsoid type of a synovial joint. So it exists between what and what? The lower end of the radius and the carpal bone. So now the next one is the articulating surface. After introduction, type, articulating surface. I will always say it now. Proximally, it is the distal end of the radius. The distal end of the radius, and also the inferior surface of the triangular articulating disc of the inferior radioulnar joint. So the radioulnar joint also take part in this communion together with the distal end of the radius bone. The distal end of the radius bone and the inferior part of the inferior radial ulnar joint. So they take part in this fellowship together with the proximal carpal bone. The proximal carpal bone, I told you who takes part in this communion. She looks to with the scaphoid, lunate, and triquetrum. Pisiform do not take part in this elbow. So between now, the joint now, the articulating surface is between the distal end of the radius and the inferior radiocarpal joint. The distal end of the radius and the inferior, what we call the radial ulnar joint. So we have the superior radial ulnar joint that want to participate in the congruency of the elbow joint, while the inferior radial ulnar joint participates in the articulation for the wrist joint. So hope you are understanding me. I hope it's making sense. So between the distal end of the radius bone and the inferior radial ulnar joint, together with the proximal surface of the scaphoid, lunate, and triquetrum. Are you getting now? So now, since you have understood that part, the next one we are talking about, because I tell you that the ulnar bone and the pisiform do not take part in this communion. The pisiform just acts as to increase congruency of the flexure carpi ulnaris. It increases congruency of the flexure carpi ulnaris. So also, what type of which cartilage is here? We are call it the hyaline cartilage. So the hyaline cartilage is located at this particular point. So the hyaline cartilage helps you to line the articulating surface. So use your head after the articulating surface, or the next covering, just like how I talked about in my elbow joint. The covering of the articulating surface is the joint capsule, or we call it the fibrous capsule. So the fibrous capsule or the joint capsule covers the articulating surface. So after you have introduced, you have said your types, you have not said the bone that is joining together. The next one we are talking about is the joint capsule, or the fibrous capsule, or the capsular ligament, anyone you want to put, but it's usually the joint capsule. I like putting it on the joint capsule. So the joint capsule now is also a fibrous non-collagenous connective tissue. A fibrous non-collagenous connective tissue, don't forget, a fibrous non-collagenous connective tissue that extend from the distal end of the radius and ulnar, down to the proximal roll of the carpal bone. The distal end of the radius and ulnar down to the proximal part of the carpal bone. Don't forget, watch my video. I said it there. I'm shouting it now. I'm saying it now. You read your book and you read it right. But for this one now, the joint capsule is formed between the distal end of the radius and the ulnar and the proximal carpal bone. So it's attaching there, back to back to back. So what are the ligaments? What ligament can I see here, please? What ligament can I see here? So the ligament I can see here is about 6 ligaments. I can see about 6 ligaments here. So I can see the radial collateral ligament. I can see the ulnar collateral ligament. I can see the palmar radiocarpal ligament. Palmar radiocarpal, because we already have a radiocarpal joint. So if you have a radiocarpal joint, you also have a radiocarpal ligament. You get it now? Same, we have the humeroradii and humeroulnar. Humeroradii is the radial collateral, humeroulnar is the ulnar collateral. So they have their own ligament on their own. So we have the palmar radiocarpal ligament and we have the dorsal radiocarpal ligament. And sometimes they used to add a palmar ulnocarpal ligament. A palmar ulnocarpal ligament. So don't forget. So the first one we're talking about is the radial collateral ligament. Very simple. The palmar radiocarpal, the radial collateral ligament extends from the tip of the silent process of the radius, down to the lateral side of the scaphoid and trapezium. So it's attaching the tip of the scaphoid styloid process down to the trapezium and the scaphoid. The trapezium and the scaphoid. And what is related there? The radial arteries. So the radial artery is related to the radial collateral ligament. Now, number 2, ulnar collateral ligament. So what ligament? You have the ulnar collateral ligament is also extending from the tip of the styloid process down to the trapezium, down to the triquetrum and the pisiform. So triquetrum and pisiform. So the first one is scaphoid and trapezium. Second one is triquetrum and pisiform, the ulnar collateral. So the ulnar collateral styloid process, radial collateral styloid process. Are you getting now? But the ulnar collateral insert on the triquetrum and the pisiform. Okay, these are also giving stability of the two sides. They are giving stability of the two sides. So now we have the palmar radiocarpal ligament in front. Palmar is your front of your palm when you supinate. Palmar. The palmar radiocarpal ligament extends from what? The lower end of the what? Radius in the anterior part, lower end of the radius at the anterior side, and insert on the scaphoid lunate triquetrum. That is where the joint capsule is also attaching. That's where the joint capsule is also attaching. So you just stick in the joint capsule already, because the fibrous capsule or the joint capsule is already there. So it's extending anteriorly. So when you switch it off for posteriorly, it's still the same thing. It's attaching the lower end of the radius to at the back, the lower end of the radius to the same bone, the scaphoid lunate and triquetrum, front and back. So in the front you have the palmar radiocarpal ligament, which is coming from the same place the joint capsule is coming from, lower end of the radius to the scaphoid lunate and the triquetrum. The palmar side and the dorsal side, front and back, allowing for anterior stability, allowing for anterior stiffness, strongness and stability. Also dorsal radiocarpal ligament allowing for stability there too. Also there's also the palmar ulnocarpal ligament, which means the ulna is taking part in this union with the styloid process. Are you getting now? The styloid process of the which is the styloid base of the styloid process, and they are joining what? Articulating discs down to the lunate and the triquetrum. So it is not usually present, but I want you to know all ligaments. So we have the palmar ulnar ligament from the styloid process. We have the palmar ulnar ligament. We have the palmar ulnar ligament, which is the ulnar, palmar side, ulnar to carpal, styloid process, ulnar to carpal, styloid process of the ulnar down to the what? The lunate and the triquetrum. Ulnar, styloid process down to the what? Lunate and the triquetrum. Don't forget. We have the palmar radiocarpal from radius to carpal, dorsal radiocarpal at the back from radius to carpal. We have the radial collateral from the radius side to attaching the radius side, styloid process down to the bone itself, which is scaphoid and trapezium. We have the radial collateral and the ulnar collateral too, the same thing. So hope you have understood everything I've talked about in that place. Hope it enter your head. So now we have the relation now. So what is the relation? I get it now. The relation of this joint is so simple. So what is passing the front? Just know that the muscle, the anterior compartment of the forearm passes there. The muscles of the anterior compartment of the forearm passes there. But majorly, the content of the what? Carpal tunnel. The content of the carpal tunnel, which is the tendons of the flexure digitorum superficialis and the tendon of the flexure digitorum profundus. Don't forget, flexure digitorum superficialis and profundus are content of the carpal tunnel that passes the wrist. Content of the carpal tunnel that passes the wrist. Okay, now why the content of the cubital fossa forms the anterior relation of the elbow joint? Why content of the carpal tunnel forms the anterior relation of the wrist joint. So before you watch all these things, as I'm saying it, there's a video. You cannot use this one to understand everything. You have to go back to that video and watch it. If you watch that video, you come back here, because most of these videos are leading to themselves. So you cannot use this video to understand everything. You have to follow the series of how the video is before you understand it. So also I told you the content of the carpal tunnel. So after the flexure digitorum superficialis, flexure digitorum profundus, you also have the median nerve too. So the median nerve is the content. 10 tendons passes there. 10 tendons, 4 tendons of flexure digitorum superficialis, 4 tendons of flexure digitorum profundus, the median nerve, and the flexure pollicis longus. And the flexure pollicis longus. All these people passes through the carpal tunnel, and they are also the anterior branch or the anterior relation of the what? The anterior relation of the carpal joint, or we call it the radiocarpal joint or the wrist joint. Don't forget. Also, due to the ulnar nerves and vessel flies over the flexor retinaculum. Remember, only median nerve passes inside. Only median nerve passes inside. The ulnar nerves and vessel passes above the flexor retinaculum, which makes it anterior relation of that same place. And also the flexor carpi radialis, which is also a muscle of the anterior compartment of the arm, passes. So go watch my video on the anterior compartment of the arm, of the forearm rather, sorry. Posteriorly now, The same thing passes through posteriorly. You know all our posterior. Now the main thing here is the extensor tendons. Are you getting me now? The extensor tendons, we know all the muscles of the posterior compartment of the forearm passes there to the what we call the extensor retinaculum. So there's a flexor retinaculum forming the carpal tunnel, and the back we have the extensor retinaculum. So I will show you the picture of extensor retinaculum. You see the extensor retinaculum there. That is where the extensor muscle of the forearm passes through to reach the fingers. It passes through the extensor retinaculum. You get it now? Also, you see the anterior interosseous nerves and vessel. The anterior interosseous nerve and vessel also passes posterior too. Anterior interosseous nerve supplies deep muscles of the anterior compartment of the forearm. Anterior interosseous nerve and vessel, they supply muscles of the anterior compartment of the arm. Lateral now, what is related to lateral now? Now the lateral part is, you have the radial artery is lateral. The radial artery is lateral. I told you it's related to the radial collateral ligament. The radial artery is lateral. You also have the tendons of the abductor pollicis longus, tendons of the abductor pollicis longus, and tendons of the extensor pollicis brevis. Tendons of the extensor pollicis brevis. So you are seeing all these pictures. This picture I'm showing you now is giving you the relation. So you can see lateral, you see those two people there. See lateral, you see those two people. So you can see that red structure called the what? Radial artery. You can see the abductor pollicis longus. You can see the extensor pollicis brevis. Now, anteriorly, you can see tendons of the flexor digitorum superficialis, flexor of the tendon of flexor digitorum profundus, and you have the flexor carpi ulnaris. You can see the palmaris longus. All of them, you see them there. Let it be in your face. So you can see the back too. I've given you the back one too, so don't forget. Medially, now what can you see medially? You can also see one thing, the dorsal cutaneous branch of the ulnar nerve. The dorsal cutaneous branch of the ulnar nerve. You can see it just in this diagram I'm showing you. Open your eyes, you have to memorize it 100%. So there's no bursa in this joint. There's no bursa here. To move to the movements. How many movements can this give us? How many movements? Same as we did for elbow joint. Elbow joint can only allow two movements. Only two movements. Why this wrist joint can allow how many movements? It can allow 5 movements. But you have the flexion, you have the extension. Flexion, extension, abduction and adduction. And you also add circumduction. Flexion, extension, adduction, adduction and circumduction. So but we have radial deviation, ulnar deviation. They can also be part of the communion there. The flexion and extension occurs along the transverse axis. Why abduction and adduction occurs in the anterior posterior axis. Don't forget. Hope you're understanding me. Go through it 100 times. Look at the picture, memorize it. You get it now? Go through it 100 times and you understand it. In flexion now, who does flexion? Flexion of the wrist is usually muscles of the anterior compartment of the forearm. Go to that video and watch it. Flexion of the anterior compartment of the forearm, PFF. Don't forget PFF. So the primary one is the palmaris longus, flexor carpi radialis, flexor carpi ulnaris. You get it now? Pronator teres do not do flexion. It does pronation. It's also a muscle of the posterior compartment, but it doesn't do flexion. The key muscle here, flexor carpi radialis and ulnaris, and the palmaris longus. Now, extension. Who does extension? Extension muscle, which is the extensor carpi radialis longus, extensor carpi radialis brevis, and extensor carpi ulnaris. They do extension. You can see it there. Very, very important, very, very sweet for you to know. Go to that muscle, my muscle playlist, and listen to it. So who does adduction? Who adducts? Adduction. Flexor carpi ulnaris and extensor carpi ulnaris. They assist themselves in adduction, but flexor carpi ulnaris does flexion and assists in adduction. Extensor carpi ulnaris does extension but also assists in adduction. So it's very, very easy. Who does abduction? Flexor carpi radialis does abduction. Extensor carpi radialis longus and brevis does abduction, and abductus pollicis longus. So you get it now. Flexor carpi radialis does abduction. Flexor carpi ulnaris does adduction. Abduction, adduction. You also have extensor carpi radialis. Everything about the radialis, abduction. Everything about the ulnaris, adduction. You get it now? So hope it's making sense to you. So if you want to know the muscle very well, go to my former video on the muscles of the anterior and posterior compartment of the forearm. You see where I explain it 100% for you to what understand. Also, stability is also the same thing. So what stability do we have to the joint? Remember, muscles contribute to stability, ligament contributes to stability. So every muscle that passes through this joint give a stability to this joint 100%. It gives a stability to this joint. So hope you are understanding it with me. Very, very important. All ligaments too, all the whole 5 ligaments I call, they also give a stability to this joint. They also give a stability to this joint. So hope you have understood it. What is the blood supply? The blood supply is so simple. You have the branches of the dorsal and palmar carpal arc. So the is what we call the dorsal and palmar carpal arc, formed by the radial and ulnar arteries. Dorsal and radial palmar carpal arc. Dorsal and palmar carpal arc, formed by the what? Ulnar and radial artery. They give blood supply to these joints. And also we have the nerve supply. Every nerve that passes through these joints give a supply to the joint. So which nerve passes there? Medial nerve passes to the cubital carpal tunnel rather. Medial nerve passes to the carpal tunnel. We have the radial nerve passes through at the back too. Are you getting that? The radial nerve supplies also, and the ulnar nerve also supplies. So the anterior interosseous nerve of the medial nerve, the posterior interosseous nerve of the radial nerve, and the dorsal and deep branch of the ulnar nerve. So since you have understood the blood supply and the nerve supply, what is the next one? Let us finish it up and get a clinical correlation. So what is a clinical correlation here? The simple thing about the clinical correlation is that immobilization of the wrist joint. Are you getting now? The wrist joint is usually immobilized. So if you want to keep the wrist joint, you don't flex it. Are you getting now? You dorsiflex it, like me, you extend it a little to about 30 degrees. Are you getting now? You only dorsiflex it at 30 degrees. You don't flex it down. You only dorsiflex it a little. Are you getting now? At 30 degrees. Important for you to know for exam. Also, when there's inflammation due to what issues or any inflammation to the joint, maybe the bursa gets inflamed, or there is a wear and tear about the muscles and the joint and it gets inflamed, what do? You aspirate, just as we did what elbow effusion. So that's how we are doing what wrist effusion. So when there's wrist effusion, what do? You place the needle posteriorly. So when you place the needle posteriorly, immediately just below the styloid process, that one is below the olecranon process. This one is below the styloid process. Are you getting now? Between the tendons of the extensor pollicis longus and extensor indicis. So when you place your needle there, you can aspirate the fluid 100%. You can aspirate the fluid 100%. So I hope it all makes sense to you. You have understood everything I've talked about in the what wrist joint. I've done the elbow joint and I've done the wrist joint. I hope it made sense to you and you love it and you love all the video I do. I introduce, so in this one we don't have the bursa. There's no bursa here. Oh really? So but they have separate bursa, but they don't have any bursa in the joint. So hope it made sense to you. I introduced it, said it's between the distal end of the radius and the proximal carpal bone. What types of joint? It is an ellipsoid type of a synovial joint. Ellipsoid type of a synovial joint or a synovial joint of an ellipsoid variety. So articulating surface, I said it, between, I told you that the ulnar and the pisiform do not take part in this joint. So if you are new to my channel, make sure to subscribe and turn on your post notification button so anytime I drop any video, you're sure to be notified. If you want me to make a video for you, make sure you drop it down in the comment section. I promise I'll surely make that video for you. I'll be seeing you in my next video, which is the hip joint.